Thank you, Alberto. And thank you to Dr. Duker. Thank you to all the sponsors. Thank you to everyone for coming and showing up today. So I'm here to talk to you about devices and technology in Parkinson's disease and the future as I see it. It's going to be a little bit different from the future that Alberto just painted, but hopefully I'll be able to paint as nice a picture as Alberto just did as well. So the first person I want to introduce you to is this guy. His name is Li Wen Liang. Does anybody here know who this gentleman is? Well, he was the whistleblower that originally alerted the world to the coronavirus pandemic that broke out 3 years ago. So for me, he's kind of like a model of advocacy and a model that I try to live up to. Here he's quoted as saying, a single society must speak with more than one voice. So he's also a dissident. He died, though, unfortunately, from coronavirus, just I think March in 2020. But he's very much a symbol that I try to live up to and somebody that I try to espouse to be like, as well in my own advocacy. But first, I'm going to walk you through the journey that I've been on that's gotten me to where I am today. So it began here in Nairobi, Kenya. I know what happened since then, but a lot has happened since that picture was taken. I was born in Nairobi, Kenya. But I had like a wanderlust. I always wanted to go out and see the world. I wanted to travel. I wanted to see as much of this beautiful world as I possibly could. And so I went out. I worked in Korea, and then I worked in China for a long time. But then, while I was living in China, working in China, I started to notice a little bit of shaking, as you might be able to see in me right now. But at the time, I didn't think much of it. I thought, just some shaking. I could live with this. It's not a big deal. But then, before we get there, actually, so here, this next picture was taken almost 10 years ago, exactly to this day. This is right before I got diagnosed myself with Parkinson's. I was taken on a trip, though, back to my home, to where I was born, in Kenya. My father took this picture as well. And, so at that time, we started to notice that something might be wrong with me, because my hand was shaking quite a bit at that time as well. We didn't know what it was. We didn't know what to call this disease yet. I didn't even know what Parkinson's was at the time. But then, in November, 10 years ago this year, I was diagnosed myself with Parkinson's. That's obviously very difficult news for anybody to take on. It's very difficult news for anybody to bear as they ask themselves, because I was still very young. I was 29 years old. I didn't know what I was going to do with the rest of my life at the time as well. But then it took me like 2-3 years for me to figure out that I really wanted to try and do something about this disease. So then I came back home to Toronto, and I started to send emails to all the experts that I possibly could in the world. I would send like maybe 10 emails per day out into the world, and I'd get about 1 response for every 10 that I sent out. Now that's kind of flipped, thankfully, but it took a long time for me to get to where I am now. It took a lot of, frankly, I had to pay my own way for a lot of years to get to these places. And so then I started to give talks about everything that I thought about this disease and everything that I've been through. It began here in McGill, this next picture that you see in front of you. This is in McGill, this is 2019 now. I was able to convince one of the neurologists or one of the neuroscientists who worked there, his name is Ziv Ganor, to let me get on stage and just talk. He gave me 5 hours to talk to all of his students there. So I was able to convince him anyways to let me just rant for 5 hours. And they're very receptive to what I had to say as well. But, it hasn't been a very nice journey as well. I've had to go through a lot to get to where I am, like I said. One of the bigger things I had to go through was this: deep brain stimulation surgery. Now this surgery, I did this about 2 years ago now. It's the reason why I'm able to travel and work and live again. And it's brought me to this place, like I mentioned before. It's allowed me also to continue to live the life that I want to live. And that's a big restraint that Parkinson's imposes upon everybody. I mean, it really does trap you, and it makes you feel like you can't do the things that you want to do anymore. But I'm thankful for this procedure that I've been through and for everything, and for my whole team in Toronto, for allowing me to get to where I am. But there's, an overarching question that I'm kind of here to answer is that why do devices matter? Well, they matter because all of the models that scientists use to try and recapitulate what this disease is in people, they all fall short. None of them are the real thing. None of them are what we experience on a day-to-day basis. None of them can really capture what it's like to live and breathe with this disease called Parkinson's. If you look at this chart in front of you, you'll see that most of the symptoms that we try to model, they only begin about the sixth one down with bradykinesia, rigidity, and tremor. We don't have a good understanding about how to actually do this properly yet. And yet, most patients, and this was a survey done by a friend of mine named Soania Mather 6 years ago now, where she asked one question: which symptoms of Parkinson's disease bother you the most? This is the responses, these were the answers to that survey. Number one, there's neuropsychiatric things, so that's cognitive issues and the fear of cognitive issues as well. That's a big imposition that a lot of patients have to deal with on a daily basis. Now, why do these things matter? Because we're all individuals here. We all have our own lives. We each one of us have our own stories to tell as well. And yet, every clinical trial, or almost every clinical trial of Parkinson's, tries to lump us together into one box. It puts us under one label, and that's a label that I don't think really applies to many people here. I look around this room, I see a lot of different kinds of this thing called Parkinson's disease as well. Here's a quick little graph that shows kind of funny way that some people look at these things. But essentially what it is it's about, every study that's ever done in Parkinson's disease, it ends by drawing a line through the study. And that line is something that represents the entire outcome of whatever study is being done there. But you'll notice that almost none of those dots fall neatly onto that line. And something that I love, something that Alberto I know is trying very hard to do, is trying to recruit people so that we just have a study where people fall neatly onto this one line. Because as soon as because look at all the outliers, all the people that don't fall onto this line. Every single study that's ever done looks something like this at the end of the day. Another big reason why devices matter so much is because of the simple fact that it's very difficult to track this disease. We get about 20 minutes every 6 months with our neurologists. That's not nearly enough time to accurately try to manage what this disease is. And to sum this up much better than I could, here's a picture drawn by a friend of mine named Sarah Reguer. So what can we do about this? What are the options that are available to us today? Well, unfortunately, they're still not very good. They're still very crude options, and I'm sure that when medical history looks back on this time in history, they're going to look at it like we look at trepanations from 200 years ago. Trepanations were like a hole was drilled through the brain, and then it was thought that like diseases or ghosts would be emitted through those holes in the brain. But these are the 4 major surgical options that are available to most patients. That's gene therapy on the left, focused ultrasound, deep brain stimulation, and then cell replacement therapy. Each one of them has its positives and its negatives. Each one of them has patients that it would work better for. However, we still don't know who those patients are exactly because we don't have the data really to go off this yet. And so this is a question that I was faced with as well. Looking at these 4 cards, though, I had to make a choice. I chose deep brain stimulation as the one that was best for me. It had the longest clinical history behind it, and it had the best outcomes, frankly, for patients that had my symptomology as well. At the time, I was either very rigid or very dyskinetic. So it was always like either moving about or I was very stiff and very rigid and had a very pronounced tremor as well. Now this next picture, if anybody's kind of squeamish, you might want to look away. It's a little bit graphic right now. I've actually had one person faint from viewing this next picture. So yeah, if you can't stomach these kinds of images, then look down right now. But this was taken during my deep brain stimulation surgery. I was awake for this entire procedure as well. It was about an 8-hour procedure, and it was not a very pleasant thing to go through, to say the least, but something that I've been very proud of and very thankful that I was able to have the chance to actually go through it all. And now I'm going to show you a quick video that's going to show you some of the benefits that I've received as a result of getting this deep brain stimulation surgery. This is me before they actually turned on the device. This is from my first visit, my first programming session as well. So here I am before they turned on the device. That's what my gait was like at the time. You can see that my hand was very rigid as well. And there, and just now he turned it on. So that feeling that washed over me is one that is very hard to describe. But it's one that I'll always remember what it felt like when he first turned on this device, because it did open up a world for me. It opened up literally the whole world once again. I was able to travel again. I was able to, like I said, live my life. There have been some drawbacks, as you might be able to tell. I've gained some weight since then. But it's been really one of the few negatives that I've experienced as a result of having gone through this surgery. And you can see my gait improving as you continue to watch these videos, and you can see. But the transformation that took place, it came with some other negatives as well. There's some personality changes that I had to go through. I went through quite a few manic spells, or hypomanic spells. And I'm happy to, later on I think I'll be addressing questions about this as well. If anybody has any questions, feel free to come up and ask me during this talk or afterwards, or while we have a chance together here. But yeah. So next, I'm going to talk a little bit more about wearable devices. So along the way, I met a company in San Francisco. They're called Rune Labs, R-U-N-E Labs. They have this device called Strive PD, Strive Parkinson's. It's an app that, unfortunately though, it's only available to Apple users. So if you have an Apple device and an Apple Watch, anybody can download this. It's completely free for patients. It's also free in the sense that, so if you talk to your doctor about being part of Strive PD, tell them that you want to be part of that, then we can actually ship you an Apple Watch for free as well. So you have that added benefit. But what it does is it gives much more detailed information back to your clinicians, and also it's better information for you to look at, so you can more accurately report what you've been through, what you've been going through. Also, soon enough, we're going to be seeing some improvements to this kind of technology. So as you can see on the left there, I can now much more accurately report my tremor and my dyskinesia back to my neurological team. And what's very important about this is that it's a continuous monitor as well. So instead of getting that one snapshot in time when I go into my clinic, I can now get a week or 2 weeks or even up to 3 months. We can all look back at my data and we can see how I've been doing. However, this is really only good for a small select group of patients right now, because it's only really for those who are tremor dominant and who have pretty severe dyskinesia, like I had as well, or I still have from time to time. But soon enough, we're going to be releasing an update to this, I think early next year, in which we're also going to add gait measures, speech measures, and postural instability measures. So you'll be able to see on this graph that you see right in front of me, just like you can see my tremor, my dyskinesia right now, you'll be able to see very clearly how I've been doing over this past week or 6 months or however long it takes. This is particularly important for clinical trials, because imagine tweaking something in a clinical trial, and then you can see, and you can zoom in and see at any given moment as well, how you've changed over time. That time signature is a very important part of what we're trying to do here as well. Now, Alberto talked a lot about brain fables and the CCBP, and I've been very grateful to him for allowing me to co-author that book with him. But it's also inspired me, and it's given me the impetus to go on and do more as well. So in December of this year, you'll be able to kind of get a refresher on some of the things I talked about here in this book. This will be my next book that I've written with Dr. Alfonso Vazzano. He's my neurologist in Toronto. He's one of the best DBS experts in the whole world. And we wrote this book to help patients like myself better understand what it's like, what they might be going through one day with DBS. I'm not sure if this will be exactly what the cover will be at the end of the day, but this is our working cover and our working title right now. But yeah, so with that, I'll say thank you and invite our next speaker, I believe is Adam McGee, up to the stage right now. My last kind of words will be that if there's ever anything that I might be able to do to help anybody here, feel free to reach out through any of these channels or any of these memes or any of these places. I very much tried to be the bridge between these worlds, and I try to be the bridge between the patient world and the physicians and clinicians. And the last thing I want to say is that if there are any patients here that want any help getting into any clinics around the world or going to talk to any scientists or doctors or researchers, please try to use me as a resource. That's what I try and do with my advocacy now, is try to help as many people as possible walk the road that I've walked so that it's a little bit easier for them. And so that also so that some of the doors that I've opened up can be opened up to more people. Yeah, thank you very much, and bring on Adam McGee now to lead us in the